Now, in the same channel, we have an exciting presentation about something that, well, we spoke about personalized medicine. That is very, very important. However, all diseases are linked to oxidative stress. And then prevention, not of a particular medicine, of a particular disease, but in many diseases, using control of oxidative stress is also important today. So they are complementary, personalized medicine and using controlling oxidative stress to prevent especially, but also to cure several diseases. So that's the subject of the next presentation is given by Professor Haruhiko Inufusa. We need to put the, okay, sorry. This is, there are two coins of the same medal. On one side is a personalized medicine, which has to be, you have to, as Professor Chiano mentioned, you have to calibrate the bullet at the disease. But now we have a different coin of the medal. If we are able to control the oxidative stress, we can prevent numerous diseases without being specifically for each one of them, but at the same time even curing them. So that's another horizon of medicine today. And then please, Professor Haruhiko, it's a pleasure to have this with you.
Thank you very much. Try this different one. Good morning, ladies and gentlemen. I'm really happy to, great honor to here and talking about my little bit about my research things. Okay, and then yes, I titled my presentation "Fields of Dream." Oxidative stress research field. And yeah, maybe all you know that movie, Field of Dreams. And then this is a story about a ghost, baseball player, legendary, all are gone, and the ghost together played at the baseball at one field. Yeah, but our target is not to achieve the ghost together. How to postpone to be a ghost, okay? So that is a longevity. This is very important. So now longevity is the market size may exceed $1 trillion per year. And then many products are fraudulent or ineffective. And then the pharmaceutical. Problem of the pharmaceutical is only allowed to contain a single substance, such a protein, chemical, or compound, so that one single, one single thing cannot solve all problems, okay? So that the very, very limited effects. And I was talking about the basic and the clinical data of Twendee X, and then additionally, I would like to introduce device which reduce oxidative stress. So this slide is from last year's in Switzerland Longevity Investors Conference. An interesting guy, this guy name is Aubrey de Grey. I would like to introduce what he's going to be saying. And then he says, we need technical improvement That is right. But what he is saying is a human lifespan will be possibly over 1,000 years. And then to achieve that, we require 40 billion US dollar for research, okay? And what he said is, okay, first, let's extend our lifespan by 20 years. Are you sure? Of course, he just want to, have money. But what he is good thing is we need technological improvement. This slide is from Cells 2023. Hallmarks of aging. What we need is over 12 important technical improvement required. And then I little bit talking about that the oxidative stress. We cannot see that oxidative stress because it is starting from a gas. But you can imagine in our body, like a white blood cell, neutrophil, uses a bleaching agent, killing germs, like hypochlorous acid and the hydrogen peroxide. This is a bleaching agent for the crosses. And then hydrogen peroxide increase in your body, that's meaning whole inflammation in your body. So these two ingredients is very important protecting our immune system. But increasing that oxidative stress means whole of your body was damaged, and then immune system is going down. And then reactive oxygen species, oxidative stress, and cause lots of damage, DNA damage, membrane lipid peroxidation. But anyway, almost all disease like inflammations, cancer, and then arteriosclerosis, hypertensions, and brain ischemia, dementia, all are coming from the oxidative stress. So I invented named in the Twendee X. That is a very simple, complex 8-ingredient, several vitamins, coenzyme Q10, and then amino acids. But this composition has a very, very strong antioxidant effect, and then patented, and also it is no need for that safety test because this is not a pharmaceutical, just a supplement. But we did the chromosomal abnormality, poisons, mutations, and so on, because that effect is very, very strong. After 2 to 4 weeks intake of Twendee, and oxidative stress level is going down to an average 30%. And then many doctors try to do same thing using that statins or branched amino acid, but they are only reducing that 5 to 7% after 6 months. So that you can see that how Twendee X strong in your body. Okay, so this is the schemes from how to develop Alzheimer's disease. And then people will have a hypertension or diabetes or acute stroke or small vessel disease. That's increasing that oxidative stress. Oxidative stress in your brain causes the inflammations like IL-1 beta. And then this inflammation, amyloid beta productions. And once amyloid beta developed, this cycle is going on, and Alzheimer's. So this is the data from the Okayama University and Professor Abe. He did mice experiment with Alzheimer's disease, and then as you see, Alzheimer's model producing a lot of amyloid beta. However, mice keep going, taking that the Twendee X, this amyloid beta is going down. That meaning is prevention of the Alzheimer's is possible. And then the same time, in your, this is the mice experiment. Here is the oxidative stress markers, and here is the inflammation markers. As you see that the oxidative stress and the inflammation is going up, but the Twendee X reduced dramatically that these oxidative stress and then inflammations. And then this publication was 1998, 19 Journal of Alzheimer's Disease. This clinical trial was conducted by a Japanese Society of Dementia Preventions. And then the data shows, you can see that the Twendee X group prevent that dementia score going down in the 2 parameters. And then the question is why Twendee X have such a preventive effect on the dementia. So there is a lot of experiment we did, and then this is oxidative stress measuring company, ICDD, in France. So they did Twendee X reduces mitochondrial oxidative stress 63% going down, and then instead neutralizing enzyme of oxidative stress is going up 147. And then at that point, this company CEO said Twendee X is the most effective anti-ROS without side effect. And this is a metabolome analysis using Hep2 cell lines. You can see that the Twendee X increasing that many metabolism in the red lines. And then these are all from energy production in the mitochondria. And next is neogenesis nerves in the hippocampal dentate, dentate glyphs. And Twendee X, young mice have a nice number of that neogenesis nerve cells, but after that 50 weeks, this number is going down to 2 to 3rd. However, Twendee X administration can keep the neogenesis nerves numbers. And then the telomere. Telomere was, research was granted Nobel Prize, as you know. And then this is a diabetic mice, and a really old one. And then controls telomere was increased by a Twendee X. That meaning is your lifelong expectation will be prolonged. So this is diabetes experiment. And normal mice, oxidative stress level is like 120, but coming to that heavy diabetes, this parameter going up. However, administration of the Twendee X reducing that this oxidative stress. And then this is also a Nobel Prize research by Japanese scientists, autophagy. Autophagy is a cleaning system of our body, and then if that cleaning system does not work well, like amyloid beta or tau protein will be accumulate. As you see, the controls all autophagy band is gone, but administration of the Twendee X, they kept some, autophagy systems. And then I would like to talk about a little bit for COVID things. And COVID infections cause lots of symptoms and then problems. And actually, infection of the COVID does not make pneumonia directly. Once COVID infected, they produce oxidative stress, reactive oxygen species. And then this ROS producing the pneumonia, and then immune system dysfunction, and the blood clot. So that is very clear that the oxidative stress is the core of COVID-19 infections. And then we did Twendee X administration. This is a vaccine side effect patient. There is a lot of symptoms: fatigue, breathing difficulty, chest pain, smell and taste disorder, or headache, brain fog, and joint pain, and dizziness, something like that. And then the 4 weeks administrations, you can see that all symptoms significantly decreased. And then another experiment was done for the long COVID patients. So as you see, that long COVID patients have same health problems. And then the 4 weeks administration of the Twendee X reduced at almost half of the symptoms. And then I said that the technical improvement, technology improvement required for that longevity. And then there is a, 12 parameters exist, and the Twendee X is almost all technical improvement was already cleared. And then I want to show that the last thing is I invented that massage device. Massage device, just naming the good. And then this device is made by expanded polystyrene, strong yet moderately flexible. And then I really, thinking about that shapes. And then I had the evidence from clinical studies, and then patent now pendings. Because if you move that the muscles, oxidative stress going down, and then maybe you feel that muscle stiffness. That's all oxidative stress gases. And this is a research trial of using a massage device, 30 minutes self-massage for that 8 males. This is before that treatment, and then this is after treatment. You can see this is hydrogen peroxide levels significantly going down. And then the muscle pain is gone, and the muscle is going to be reluctant. And then I use this device for that one patient. She is a very famous singer in Japan, 40 years old, and then she developed that polyp on the vocal cord. And then you can see that vocal cords usually pink and really thin, but her vocal cord is white and then thickness. So she cannot sing properly, especially in the high tones. And then I was asked to treat her, and I met her this year, February 15th. And then I recommended oral administration of the Twendee X. Mitocontrol is a little bit more effective one. And then using good massage device for the stiffness for the neck and shoulder muscles. And then 5 months later, she going to the doctors, and then polyp is gone, and then the vocal cord back to the normal. And then the physician says, "Oh, this is a miracle that happened to maybe in 1 in 2,000 poly patient. So she was able to avoid that surgery. So, and then how to achieve the longevity? That is no easy way, okay? No pharmaceuticals or no, gene therapy, single gene therapy. And then pharmaceutical product have an effect, but very limited, not for that all for longevities. However, reduce oxidative stress is not so difficult. Maybe you can use that my invention things, Twendee X, or as a supplement or something, or especially local problem. For that lady's case was the vocal cord, and same thing is tinnitus and the hearing loss really connect to that your muscle problem of neck and shoulders. So thank you very much for that patience. That is all my presentations.
Thank you very much, Professor Haruhiko. This is another horizon. He has worked for so long on oxidative stress, and we have seen the result in so many fields. I mentioned yesterday during the dinner that I started using Twendee just for prevention since 2008, when we met for the first time at SIPS in Rio de Janeiro. And since that time I've continued, I rarely get sick. But you see here now the expansion, multi-dimensional expansion of the use of antioxidant to reduce, to control, not necessarily reduce, but to control the oxidative stress. So we have a specific symposium on oxidative stress. It will be held in this room. It's one of the most successful one of this summit, and it is dedicated to lifetime achievements of Professor Haruhiko. So anyone interested, it's a full 3 days conference. Magnificent results. Thank you very much.
Thank you. Appreciate it.